Hello, my name is Rita Benamor. I'm an osteopath from Portugal, and I am an instructor for Barral Institute for the classes of Visceral Manipulations, level 1, 2, 3, and 4, and also Neuromanipulation 1. I've been teaching for 6 years, and I've been doing this work for 17 years, and I have to tell you that using Visceral Manipulation in my practice has completely changed the way I work and also the results and the way I can help my patients to feel better or regaining their original health, let's say like that. I'm going to talk to you about Visceral Manipulation, the third level, number 3. We call it VM3. It's the pelvic class. Sometimes when we hear about pelvis, we say, oh my God, that's not a place I want to work on. But actually, this is a class that can help our patients to recover their dignity and their independence. And when I say dignity, I say there are so many problems like urinary incontinence, for instance, that people really feel ashamed and get limited to get out and to go visit someone or just be in the streets. And we can help them getting better from that. And when I mean independence, I mean when we start getting older, most of our problems start concentrating in the pelvic area, and that is often going to affect the way we walk and the way we can move and use our legs. So most of us, well, when we are younger, we don't think about it, but when we start getting older, we are always afraid, how long can I be independent and go to the grocery store and do my normal life by myself without depending on other people? And in that, having a good use of your legs is really important. So the pelvic class can really change and help a lot with hip problems and pelvic problems, but also knees and foot and so on.